Hi, it's Georgie, and this is Fempower Health Audio Insights, where I break down the biggest issues in women's health so you can navigate the system with confidence. Whether you're a patient, policymaker, or provider, these insights give you the power to make informed decisions. Today's piece is around hysterectomies, and it is actually the first I did in my Informed Consent series, which was inspired by insights I noticed after interviewing well over 100 of the leading experts in women's health, which is each expert was very knowledgeable in their particular space, but as we've all noticed when we've experienced the healthcare system, we're often the ones in the middle of navigating all of these experts so that we can get the care that we deserve. And I noticed that theme when I interviewed doctors around hysterectomies. So I thought I would summarize all of these insights to put it all into one easy package for you if you know of someone navigating this or you are doing so yourself. So let's dive in. Imagine walking into a doctor's office to address debilitating pelvic pain or endless heavy periods. After a few minutes of conversation, you hear the word hysterectomy. Relief might wash over you. Finally, a solution. Or panic. What does this mean for my body? But one emotion is almost universal among women undergoing hysterectomy: confusion. Rachel Gross, who's actually been on the Fempower Health podcast and writes for the New York Times, recently highlighted in her own New York Times article on this topic, there are few procedures in which patients routinely go under the knife without understanding their full range of options or leave the operating room not knowing exactly which of their organs remain. Yes, this is true, and more on that coming up. So today we'll unpack these complexities of hysterectomy, what it is, why informed consent is critical, and how you can advocate for yourself to take control of your health. So first, let's talk about why you might need a hysterectomy in the first place. As I said, it's one of the most frequently performed surgeries in the United States, primarily used to treat significant gynecological issues. The most common indications include uterine fibroids, abnormal uterine bleeding, endometriosis, and pelvic organ prolapse. So there are minimally invasive techniques such as vaginal and laparoscopic hysterectomies, and they are preferred because of their shorter recovery times and reduced hospital stays as compared to open abdominal surgery. And the good news is that the number of abdominal hysterectomies has decreased from 65% to 54% between 1998 and 2010, while the robotic-assisted laparoscopic hysterectomies did surge from 2008 to 2010 from 0.9% to 8.2%. However, vaginal hysterectomy, the approach associated with the best outcomes and cost effectiveness, has seen a consistent decline from 25% in 1998 to 17% in 2010. So, what is a hysterectomy? Well, there are different types of surgeries and procedures, and it's really important for you to understand this because you never want to leave the operating table not even being able to answer the question of what was actually removed. So I think a lot of us, have a vision of what a hysterectomy is, but there's actually different types. So let's talk about them. A total hysterectomy is when the uterus and cervix are removed. A supracervical hysterectomy is where the uterus is removed, but the cervix remains. And then if you have cancer, they'll often do a radical hysterectomy, which is the uterus, cervix, and the surrounding tissues being removed. Then there's also a hysterectomy with oophorectomy. And the oophorectomy is when you're removing the ovaries, which is often paired with fallopian tube removal. So why do the ovaries matter? The ovaries, they produce hormones like estrogen and progesterone, which are vital for bone health, heart health, and overall well-being. And removing the ovaries, again, the oophorectomy, can result in surgical menopause, which leads to hot flashes and night sweats, increased risk of osteoporosis and heart disease, and vaginal dryness and changes to sexual function. Now that may seem scary, but there are ways to mitigate all of this. Again, it's all about having the information up front so that you can have conversations with your doctor proactively instead of reactively. So hormone therapy is essential to mitigate against a lot of these effects. Dr. Jocelyn Wallace, who is also a guest on Fempower Health, emphasizes women often don't realize how removing the ovaries can drastically shift their body's hormonal landscape, and hormone therapy can play a key role in recovery and quality of life. So, if you are undergoing a hysterectomy, here are some questions to ask. Will you remove my ovaries? And if so, why? And what are the risks of surgical menopause? And is hormone therapy recommended for me? And if so, what are the risks and benefits? So now let's talk about hysterectomy guidelines and why training, reimbursement, and referrals matter, because this could also impact your own experience. So again, hysterectomy is one of the most common surgeries performed on women, but up to 70% of the procedures don't meet expert criteria for appropriateness. Updated ACOG guidelines prioritize minimally invasive procedures when feasible. And ACOG is the American College of Obstetricians and Gynecologists. However, sometimes training, experience, and reimbursement pathways, which is essentially when your insurance company reimburses the doctor for their procedures, they often influence surgical decisions. So as an example, training, experience, and technical difficulty are often cited as barriers to performing a laparoscopic hysterectomy. However, none of these factors should be considered an absolute contraindication to a minimally invasive approach. And an OBGYN may choose an abdominal hysterectomy instead of referring the patient to a minimally invasive surgeon, driven by financial incentives or lack of advanced training in minimally invasive techniques. Facilities may actually even prioritize procedures that align with their reimbursement models, even if those procedures are not the most patient-centered. This makes it crucial to discuss all options with your doctor and ask whether referral to a minimally invasive specialist is appropriate. But then there's the missing piece of hysterectomy recovery, and that is pelvic physical therapy. Pelvic PT is not included in standard hysterectomy guidelines, leaving many women unaware of its transformative potential. Pelvic PT is the missing piece, according to Dr. Jocelyn Wallace. It is not standard of care yet to do it from a preventative or proactive place. I absolutely think it should be. She points out that sadly, it's up to patients to ask. Dr. Wallace reinforces that it can rebuild the strength and support lost during surgery, addressing back pain, incontinence, and even sexual dysfunction. So some of the benefits of pelvic PT include preparing the pelvic floor pre-surgery to prevent complications and rebuilding muscle strength and improving recovery post-surgery. And if pelvic PT isn't offered by your surgeon, request a referral, and it can make a significant difference in your recovery. So what is informed consent for hysterectomy? Just to summarize all of this. So it's not just about signing a form. It is a conversation. True informed consent should include a thorough discussion of all surgical options, risks and benefits, including hormonal and structural changes, exploration of non-surgical alternatives. So ask your doctor, what type of hysterectomy do you recommend and why? Will you remove my ovaries? And if so, how will surgical menopause be managed? Are there minimally invasive options for my case? And what long-term effects should I anticipate? For example, hormonal changes, pelvic floor support. And lastly, will you refer me to a pelvic physical therapist? So what about questions to ask about minimally invasive surgery? So many women don't realize that minimally invasive surgeons and OBGYNs actually differ in training and expertise. Minimally invasive specialists use advanced techniques to reduce recovery time and complications, but they're not always the default recommendation. So some of the questions you can ask: is a minimally invasive approach possible for me? What experience do you have with minimally invasive hysterectomies? And are there reimbursement factors influencing this recommendation? Personally, I think that last one is probably one of the most important, because that will help you understand if finances are driving their decision. So take charge of your post-hysterectomy recovery as well. Post-hysterectomy, many women report significant quality of life improvements. However, Dr. Wallace emphasizes that we tend to undersell ourselves on what's possible. Yes, patients may feel relief from fibroids or pain, but they don't have to accept back pain or incontinence as their new normal. With pelvic PT, hormone therapy, and proper care, you can thrive post-surgery. So let's summarize. It's your body, it's your choices. Hysterectomy isn't just about removing an organ. It's about empowering women to make informed, life-changing decisions. Rachel Gross poignantly observed that too many women discover the fine print only after the surgery. And let this be your rallying cry to demand answers, advocate for yourself, and ensure that your health decisions are fully informed. It's your body, your choices, so let's make them count. If you have an experience with a hysterectomy that you'd like to share, please send me an email. You can send it to info@fempower-health.com. And please stay tuned as I cover other important topics in my Informed Consent series. If there's something specific you would like me to cover that I may not have thought of, please also send me an email at info@fempower-health.com. And if this was so much information that blew your mind and you'd like to read it just to have the notes in case you are dealing with a hysterectomy in the near future, please go to the show notes and you can see the link to access the article. Thank you so much for listening today, and I hope you found this helpful because it's really important for me to help you navigate this wild healthcare system. Thank you for joining me today on Fempower Health. If you'd like to continue the conversation, please follow me on social media. I am most active on Instagram, LinkedIn, as well as TikTok. You can also subscribe to the weekly newsletter if you want to stay off social media to get the latest and greatest updates. And you can find the link to that either on my website, fempower-health.com, which is a hub to all the different health topics I've covered over the past 5 years, or you can go to the show notes where there's links to all the helpful resources that are relevant to this discussion. And if you know of someone in your life who would benefit from this information, please do pass this along, because that is how we can ensure this important information reaches those who need it most. And for anything that is discussed medically, please understand that none of what we share on Fempower Health is medical advice. It is all for information purposes only, and only a conversation between you and your doctor can give you the care that you need. Thank you very much.